You feeling good? Okay. The use of blood and blood transfusions is not uncommon in the medical field and is used numerous times a day. The first known blood transfusion was done in 1628, and the first successful blood transfusion in a human being was completed in 1818 by British obstetrician James Blundell. Approximately 5 million people each year need blood transfusions of some form due to surgery, trauma, or illness. The use of blood transfusions is both a life-saving and life-sustaining medical intervention. Being a medical professional, the need to educate patients on medical interventions, including blood transfusions, is of grave importance. The use of blood transfusions can be needed for many different reasons, as well as the type of blood components used. Blood transfusions can be whole blood, which is all of the components of blood that is in our bodies, or just certain aspects of blood. The type used depends on the situation. Patients may need blood transfusions due to surgery to replace blood loss from trauma or accidents, or due to illness. It is common for patients with anemia to receive blood transfusions of red blood cells, and those suffering from hemophilia and platelet clotting disorders requiring platelets. The use of blood transfusions is very common in the hospital setting, but there also can be completed in the home setting for those patients that are gravely ill by supervised medical professionals. Patients who undergo surgeries are at great risk for blood loss. Losing too much blood can cause the body to shut down. Transplant surgeries often require a great deal of blood transfusions. About 1/3 of every heart surgery patient requires a blood transfusion. If they do not receive these blood transfusions, they would surely lose their lives. Individuals involved in traumatic events like car accidents or gunshot wounds often receive multiple units of blood. I have seen in my operating room experience a patient receive 10 units of blood in one incident. That patient survived his ordeal thanks to the surgery team and the blood he received. Patients can receive blood transfusions due to illness. Patients who suffer from different types of anemia often need blood transfusions. Aplastic, iron deficiency, and sickle cell anemia are just a few common types seen. Patients who suffer from these illnesses often have a deficiency or an abnormality in the form of this blood component. If these patients do not receive a blood transfusion, they could surely die. Another common illness that requires the use of blood transfusions is hemophilia or thrombocytopenia. This condition is a disorder of the platelets and clotting factors of the blood. It causes the blood not to be able to clot correctly. These patients are at risk for bleeding from any cut or minor bruise.
Here's a new one.
By receiving these transfusions, the platelets and clotting factors, these patients are able to live almost normal lives. While blood transfusions are generally safe and beneficial, issues can arise. Even with every safety measure followed, patients can still have allergic reactions to a blood product during transfusion. When this occurs, the transfusion is stopped immediately. The patient is reassessed before any blood transfusion is reinitiated. Patients who undergo blood transfusions often are also at risk for developing iron overload. Iron overload can cause damage to vital organs like the heart and liver. Patients who often could require the need for blood transfusions are afraid of the risk of having serious infections transmitted to them through these transfusions they are receiving. Infections like the human immunodeficiency virus, HIV, hepatitis B and C, and rarely variant Creutzfeldt-Jakob disease, which is also known as the human version of mad cow, can be passed to patients via blood transfusions. Transmission of these infections is rare and should not be a reason to withhold blood transfusions. Though not a con per se, some patients are against receiving blood transfusions due to religious reasons. These individuals who practice the Jehovah's Witness faith are against receiving blood transfusions. While it is their right to do as what they believe, we as medical professionals have to respect their wishes, even when we might not agree with them. Blood transfusions are a commonly used medical intervention during surgery, the treatment for illness, and other issues in the hospital setting as well as in the home in some instances. Highly trained medical professionals are often utilized in the administration of blood transfusions as well as their preparation. The use of blood transfusions can be life-sustaining and life-saving to those who receive them. The need for blood transfusions should not be withheld due to concerns of reaction or infection transmission. While the risk of these transfusion reactions and transmission of diseases is a real and serious issue, it is not often seen and very rare. Every available precaution is taken to ensure that these blood products are strictly tested and safe before transfused to these patients. While there are not any synthetic versions of blood available as of yet, there are medications available that can mimic some actions of blood components. These are still not as good as the real thing. There are also options to some patients for blood transfusions where the use of the patient's own blood is reintroduced after it is filtered. This intervention, often used in major surgery, is called cell saver. The patient's blood is filtered through this machine and re-infused back into the patient. With all these options available to you and your family members, should the need for a blood transfusion arise, do not overlook it as due to these issues. The benefits of blood transfusions outweigh the risks more often than not. It is important to educate patients and their families about blood transfusions to ensure that a well-informed decision is reached. Too many people lose their lives due to the issues with blood transfusions that they are concerned about and are unaware of actually how rare these events happen. I urge everyone to be aware of the medical interventions available to them and every aspect of your health and well-being. Educate yourself, ask your medical professionals, and inform yourself on all the options available to you. Blood transfusions are highly beneficial to you and your family members should the need for them arise. The use of blood transfusions is an amazing tool that we can use to save lives, and it does so every day.
Did you get us all?
I think so.